Hello, my name is Darrell Vickers. I'm a peer educator at the Center for Community Health and Prevention, located at 46 Prince Street, Rochester, New York. And today we're going to talk about prostate cancer. I want to thank you in advance for having me and thank you for taking the time for listening and learning. So let's get started. Today, we'll discuss the burden of prostate cancer on New York State. We'll talk about what cancer is. We'll identify the risk factors and symptoms of prostate cancer, discuss what the screening process is for prostate cancer, and finally, a brief summary of what we learned today. In New York State, prostate cancer is the most common cancer among men after skin cancer. In New York State, prostate cancer is the second leading cause of death in men after lung cancer. Each year, almost 15,500 New Yorkers are diagnosed with prostate cancer, and 1,700 men die of the disease. Combined, this is almost equal to the number of people in the Barclays Center in Brooklyn, New York, when it's at its full capacity. In New York State, Black men are 1.5 times more likely to get prostate cancer and almost twice as likely to die of the disease as compared to white men. Black men are more likely to develop the disease earlier in life, but more likely to be diagnosed at a later stage when the cancer may have spread. Race does not increase the risk for these poor health outcomes. Rather, racism works on several levels to contribute to these cancer health disparities. These iniquities can be found in access to health care, insurance coverages, discussion about screening, and quality of treatment and follow-up. People you may know who have had prostate cancer. Top far left, Nelson Mandela, Sidney Poitier, Robert Goumet, Ken Griffey Sr., the father of Ken Griffey Jr., Major League Baseball, the adorable Al Roker, and Colin Powell, former Secretary of State. So, what is cancer? Cancer is a condition where abnormal cells grow out of control. These abnormal cells form masses known as tumors. When cancer cells grow out of control, they can crowd out normal cells. This makes it hard for your body to work the way that it should. So what are the causes of cancer? There are many types of cancers with many possible causes. Many things affect a person's chance of getting different types of cancers. Some things that increase the risk for many cancers may include the age of a person. Cancer is more common in older people, although cancer can be diagnosed at any age. The family history of the person, whether the person uses tobacco or alcohol, the person's diet, not enough eating fruits and or vegetables, lack of physical activity, and having obesity. The prostate. The prostate is a small gland that is part of the male reproductive system. It's located beneath the bladder and in front of the rectum, and it surrounds the urethra. What is prostate cancer? Prostate cancer is a cancer that starts in the prostate, occurs mainly in older men, 65 and older. Most prostate cancers grow slowly, but not all the time. The prostate in getting older. The prostate gets bigger as a man gets older. The increase in size is common and not usually cancerous. Symptoms of prostate cancer: problems with urination, painful ejaculations, blood in the urine or semen, difficulty having and maintaining an erection, pain in the back, pelvis, or hips that won't go away. Sometimes there are no symptoms, especially in the early stages of prostate cancer. Who is more likely to get prostate cancer? Black men, older men, and men with a parent, sibling, or child with prostate cancer. Prostate cancer screening. What is it? Screening means looking for cancer before a person has symptoms. This can be accomplished by two things. A PSA test is recommended for prostate cancer screening test. It's a blood test that measures the amount of prostate-specific antigen in the blood. A digital rectal exam is something a doctor may do to check for changes in the size of the prostate gland. This is where a healthcare provider will insert a gloved, lubricated finger into the rectum to feel the prostate for anything that's abnormal. So remember, prostate problems and prostate cancer are very common. Black men and men with a family history of prostate cancer at our high risk of developing and dying from prostate cancer. Men at high risk should talk to their healthcare provider about prostate cancer screening. Men ages 55 to 69 should talk about their prostate cancer risk with a healthcare provider and see if screening is right for them. Black men and men with a family history should talk to their healthcare provider about prostate cancer screening and their increased risk for prostate cancer. Men ages 55 to 69 should talk to their healthcare provider about their risk for prostate cancer and whether screening is right for them. And screening is not recommended for men 70 and older. I want to thank you for having me today. And for any additional information, please feel free to reach me at the phone number listed below. Thank you very much.